Do you have a problem or do you have an issue about how you breathe? Is it always fast or is it always slow or is it just normal? Are you aware of the reason behind of this or are you just curious about how an individual, especially nurses and doctors, check someone's respiratory rate? Well, this video is for you. Hi, I am Kate and we are the group 2. This video is all about assessing respiratory rate and breathing sounds of an individual. So what are you waiting for? Let's start learning! The function of the respiratory system is to supply adequate oxygen to the tissues and to remove waste products such as carbon dioxide. This is achieved with the inspiration and expiration of air, and with each breath, there is a pause after expiration. Moreover, the normal or ideal values of the rate of respiration will vary with age and gender. So the respiratory rate of 12 to 18 breaths per minute is considered normal in healthy adults.
In addition, when observing the patient's respiratory rate, it is important to note the color of the patient's lips. They may be cyanosed or blue in color or discolored if the patient has respiratory problems. Cyanosis can also be observed in the nail bed, tip of the nose, and earlobes.
Take note that the respiratory rate is recorded along with other vital observations such as pulse, blood pressure, and temperature. Here are the following procedures in assessing the respiratory rate of an individual.
Explain to the patient what you are about to do, even if the patient is unconscious.
Hi ma'am, I am Nasir Bicabahog, your student nurse for today. I am here to take some tests. How are you feeling? I'm fine. Good to hear.
Ensure the patient is comfortable. Make sure the patient is relaxed as possible.
Next, observe if the patient is distressed in any way.
Can I see your wrist, sir? Okay, thank you.
It is best to monitor and record the respirations immediately after taking the pulse. This will aid in a more accurate recording as the patient will not be aware that you are observing respirations. Then, observe the rise and fall of the chest or the inspiration and expiration. This count as one breath.
In this step, I am going to record her respirations after taking the pulse. With this, the patient is not aware that I am already taking her respiratory rate to help in a more accurate reading. The respirations should be counted for a full minute in order to have an accurate reading. Note the pattern of breathing and depths of breath. The normal respirations for an adult is 12 to 20 breaths per minute. Since my patient here is a 6-year-old child, the normal respiratory rate for children her age is 18 to 30 breaths per minute. Turns out, her respiratory rate result is 25 breaths per minute, which is considered normal. A eupnea breathing pattern, which means unlabored breathing or a good breathing pattern.
Step number 9 is to document your findings on the patient's observation chart. Note any changes and report it to the medical team, like for example, if the patient is bradypnea, which is he or she has a respiratory rate that is lower than normal respiratory rate for his age, or tachypnea, which is he or she has a respiratory rate that is greater than the normal rate for his or her age, and also if the patient is hyperpnea, which is an increased volume with or without an increased rate of breathing, which is blood gases are normal.
The last and final step, before leaving, ensure the patient is comfortable.
When and how often should the respirations be recorded? The patient's condition will dictate the frequency of recording. respiration should always be recorded when a patient is first admitted into hospitals to acquire a baseline record. For our safety before and after conducting the assessment, wear gloves and always wash your hands thoroughly between patients to eliminate the risk of cross-infection.
Now, let us proceed to the breath sound assessment. So what is breath sound assessment? So clinical evaluation of breath sound is the first thing and most common method of assessing lung issue or lung health. So if a pathology of the lung is suspected, assessing breath sound helps identify probable causes. In this video, we will use the auscultation method in the chest. Although many newer techniques in evaluating lung pathology have been developed, auscultation of the chest still remains invaluable clinical tool and still probably the most common method of evaluating the lung.
In preparing the assessment, there are few things we need to consider. First is the equipment. We will use a stethoscope in assessing the breathing sound of the patient. The bell of the stethoscope is generally used to detect high-pitched sounds at the apex of the lungs above the clavicle. Its diaphragm is used to detect low-pitched sounds in the rest of the chest.
Second is preparing the environment of the patient. Listen to a patient's chest to establish breath, and any other sound requires a quiet area so that health professionals can fully appreciate what they hear and interpret their clinical relevance.
Third is positioning the patient. The optimal position for chest auscultation is sitting in a chair or on the side of the bed. However, the patient's clinical condition and comfort needs to be considered during the examination, and some patients may only tolerate lying at a 45 degrees angle. Both these positions will facilitate the assessment. You may need help to support the patient in a comfortable position during the examination.
If we already achieved the 3 steps, we can now proceed to the procedure.
First, you need to ensure your stethoscope has been cleaned following local infection prevention and control guidance. Second, discuss the procedure with the patient and gain his or her informed consent.
Hi, Ms. Hardinal. I am Nicole, your student nurse, and I am here to run some tests. Is it okay with you? Yes, nurse.
Third, check that the patient is kept warm and the area is free from the drafts. Fourth, you need to screen the surroundings to maintain patient's privacy and dignity. Fifth, decontaminate your hands according to local policy.
Position the patient comfortably so you can access their chest. Remove or rearrange the patient clothing as necessary to enable you to see the chest. Position the air tips in your ears so they point slightly forward towards the nose. This will help to create a seal and will reduce external noise. Holding it between the index and middle finger of your dominant hand, place the chest base of the stethoscopes flat on the patient's chest using gentle pressure. Using the stepladder approach, listen to breathe sounds on the anterior chest. This technique allows you to compare one side of the chest with the other side.
Next, use the stepladder approach for the posterior chest. Avoid the scapula as lung sounds cannot be heard through the bone. After that, Bring the patient to a supine position to check the left and right lateral chest. Next, ask the patient to move the right arm to the side so the right lateral chest can be assessed, starting with the upper lobe, then to the middle lobe, and finally to the lower lobe at the bottom. And then, repeat on the left side where the lung is made up of an upper lobe and lower lobe. Replace the patient's clothing and make sure they are comfortable. And then explain the findings to the patient and check whether they have any questions or not. After doing the procedure, make sure to decontaminate your hands and clean your stethoscope. And lastly, make sure to record your findings on the patient's note.
Normal, vesicular and tracheal breath sounds. Abnormal, there are several adventitious sounds, but the main ones to be aware of are crackles, wheeze, and absent breath sounds.
And that's it for today's video. I hope you guys learned something from us. Again, we are the group 2 and thank you for watching.